Joining us in the studio now for our Your Health segment, Dr. Ngozi Akabudike, an assistant professor of orthopedics at the University of Maryland School of Medicine and upper extremity surgeon at the University of Maryland Medical System. Doctor, thank you for being with us.
Thank you for having me.
When you operate on upper extremities, we're talking about this part?
We're talking about from the fingertips all the way to the shoulder.
And one of the things we wanted to talk about was overuse injuries. What's meant by that?
So it's a general term that's used to categorize complaints that come from doing certain things over and over and over again. And so that way you're placing a lot of burden on different parts of your body.
People who sit at a computer and type all the time frequently complain of carpal tunnel syndrome. Knock on wood, either I don't type that much or I've never been predisposed to it. What happens there?
So carpal tunnel syndrome is probably one of the most common ailments that we see in upper extremity disorders. And it's really a compression of one of the main nerves that go into the hands. And what happens is the nerve travels in a space at the level of your wrist called the carpal tunnel. So it's a space that's formed by the carpal bones, which are your proper wrist bones, and a ligament right here in your palm. And when certain maneuvers put pressure on the nerve and it irritates the nerve, and the predominant complaint is numbness and tingling in your fingertips. Your thumb, your index finger, your middle finger, and your ring finger.
So it's not a circulatory thing. Is it a lack of blood flow or it's a nerve impingement?
It's a nerve impingement. And it's a nerve impingement at the level of the wrist and the hands.
If you go to an office supply store, you see those little pads that are meant to sit right in front of the keyboard. So your wrist would kind of be resting on that. Does it help?
So this is a very good question. And now, even though there's a lot of data out there and a lot of things to suggest that potentially typing can contribute to it, having the wrist in a neutral position is probably the most helpful thing, so you don't put undue stretch on the nerve in a hyperextended position or flex position. So there are a lot of ergonomic aids out there, just like you described, to help you keep it in a neutral position so you're not stressing out that nerve.
Have you ever seen a teenager on a smartphone texting? I've never seen thumbs move. It's sort of like a hummingbird's wings. It's just flat, 1,000 beats a second. Does anything result from that in terms of overuse?
This is another great question. A lot of times patients will overuse and use specific joints over and over again. And doing something like that where you're firing away back and forth with the small joints of the thumbs, specifically this joint and the MP joint, can cause strains of the ligament, but typically they're self-limited and don't result in chronic issues down the road.
I was pretty sure the digits weren't designed for specifically that that function.
Correct.
But no harm. You haven't seen
typically
any.
No harm. Usually a short period of rest and splinting and avoiding that inciting activity tends to quiet the symptoms down.
Let me remind our viewers, if you have any questions about upper extremities, carpal tunnel, or other conditions sports-related that we're going to get to, we'll have the number up on the screen. Please give us a call. You could also tweet a question. Our Twitter address is @MPTNews. I mentioned sports. It's summertime, a lot of people outdoors with golf clubs and tennis rackets and that sort of thing. What goes wrong?
So some of the more common complaints we see with those types of racket sports and golfing activities are tendinitis. Tendinitis or inflammation or irritation of the tendons at the elbow and sometimes at the wrist. The very common colloquial terms, the tennis elbow syndrome or the golfer's elbow. And tennis elbow is when the tendons on the outer aspect of the elbow are the ones that are irritated and inflamed, and golfer's elbow is on the inside of the elbow. Again, the same thing, sort of this repetitive activities that cause the irritation. And patients will really notice the symptoms when they're doing those activities. Interestingly enough, we see those symptoms more in other repetitive activities, not particularly tennis elbow. So you're more likely to see lateral epicondylitis in somebody who is doing some other repetitive activities like whacking weeds or something else versus just a classic tennis player that is termed for.
So tennis elbow most often doesn't come from tennis. I'm sure you have a medical term for it. What's the solution?
Sure. The medical term is lateral epicondylitis. And again, a lot of the initial treatments is your resting, splinting, and using a counterforce strap to rest the origin of the tendon. Anti-inflammatory medications, so your ibuprofen or Aleve, any kind of anti-inflammatory over the counter, and really rest in the area.
Let's take some phone calls. This is Maureen in Baltimore City. Maureen, thanks for calling. Go ahead.
Dr. Akabudike, you had just mentioned about carpal tunnel syndrome. If it is not corrected, can that traverse further up to cause more nerve damage in the elbow and the shoulder if not corrected?
That's a great question. Thanks for calling in, Maureen. So if you have persistent symptoms that don't improve with initial conservative treatment, such as splinting at nighttime, and potentially even injections in that area that's done by a physician, symptoms can get worse and could require surgical treatment to improve your outcomes.
I believe I'd read that the carpal tunnel is pretty limited. I mean, there's a tight space, and that's the origin of a lot of this, and it's surgery, you open it up.
Yes, sir.
And talk about the procedure, how difficult for the surgeon, how difficult for the patient in terms of recovery.
Sure. So carpal tunnel surgery is one of the most common procedures that we do in hand surgery, and it's probably one of the most successful procedures that we do in hand surgery, exceeding the 90% plus of good outcomes. And there are probably two categories to think of it. There's either the standard open carpal tunnel release, where you make an incision in the palm and release the ligament that's compressing the tunnel, or an endoscopic procedure, where you make a smaller incision and through different and using guides to dilate the space, release the ligament without actually making a full incision.
Which do you prefer to do? Because I'm sure the endoscopic takes a lot longer.
So interestingly enough, multiple different studies have been done, and they have very comparable results in terms of the outcomes, and so I tend to still lean towards the open carpal tunnel release.
Right. Let's talk to Ram in Anne Arundel County. Thank you for calling. Go ahead. Ram or Ram in Anne Arundel County, you're on. Hello.
Hello. Thanks for giving me some time.
Certainly. What is your question?
Yeah. I am asking a question. Is there any research or any treatment going on for the spondylitis or arthritis on the hands?
Okay, thanks very much. Arthritis of the hand.
Arthritis of the hand can be in the fingers or in the wrist. Again, for arthritis that is degenerative arthritis, typical wear and tear of the joints, there are different treatments, both conservative and surgical treatments. So conservative treatments include splinting, therapy, and steroid injections and oral medications. And there are surgical treatments that are in the categories of joint fusions or joint replacements, depending on the joint involved.
I'm so glad you're here, because I was thinking back to this weekend, and we're in the middle of summer, and I had was clearing some shrubs and cutting back some shrubs. So I had the electric, I'm blanking on the name, but it's a hedge trimmer, and after operating it for some period of time, and this thing, vibrates and at a fast clip, I found that I was still vibrating after I turned it off. Is that a normal thing physiologically?
Yes, that's a normal thing that you can feel.
Thank you very much. Honestly, it was one of those things where I went and turned on the computer and said, "Is this normal?" and didn't find any websites with good answers. So we'll have to mark this. What happens? What causes that?
So the soft tissues have a little bit of memory, and so there's a little bit of that vibratory sensation that's still going on in the tissues even after you're done with the activity.
Good answer. Let's talk to, I'm still not going to do it again until next year. George in Baltimore City. George, thank you for the call. Go ahead.
My name is George Bess. I have problems getting up because of my weight, and I have trouble with my elbows and shoulders. Can you help me on that?
What's it feel like, sir?
Pain and numbness, and particularly in the upper shoulder area on both sides.
Okay, thank you very much.
You
What could it be, and could it be weight-related?
Correct. So many things could be weight-related, but once you start looking at numbness in the upper part of the extremities and on both sides, you want to start thinking about the neck as a potential source of where your symptoms are coming from, specifically compression of the nerves as they come out of the neck. And that's a very common thing that can happen. You can have compression in more than one area. You can have a compression at the level of the neck and distally by the level of the wrist. So that's very possible in someone like a recent caller.
Back to Anne Arundel County. Let's talk to Mike. Mike, thanks for the call. Go ahead.
Yeah, doctor, what is the difference between bursitis, arthritis, and rheumatism? Are they all basically the same, from the same cause?
All right. Any particular part of the body? Okay, we'll leave it there. So arthritis, bursitis, and rheumatism.
Sure. So they're all some form of inflammation. Bursitis is the inflammation of your bursa. I think of a bursa.
And that's the hip, right?
And it depends on where the bursa is. So their bursas, I think of it as a Dr. Scholl's gel pad that comes between two surfaces so they don't braid each other back and forth. So you can have them at the hip, the ones by the Achilles tendon, and they're also a bursa in your shoulder underneath this bone on the top. And when that gets inflamed, that's a bursitis. And then arthritis is an inflammation of a joint. The cause could be a multitude of things. It could be a degenerative arthritis, it can be inflammatory arthritis, it could be an infectious arthritis, but something inflaming a specific joint. So that's different from the bursa, which is not in the joint. And it's unclear if the patient is referring to rheumatism, that's very different, and something that's caused by rheumatic fever, which is a joint inflammation associated with a prior infection with strep. Or if it's rheumatoid arthritis, then that's a different type of inflammatory arthritis.
So it's osteoarthritis and
exactly.
Rheumatic.
Rheumatoid arthritis is an inflammatory arthritis. It's a completely different category.
You mentioned the anti-inflammatories a second ago, and ibuprofen, and I guess Aleve is maybe one of the other types. Talk about that for a second. Does that work better in some people than others?
Sure. The anti-inflammatories are a very good first line of pain medication and relief for a lot of initial overuse injuries. Most of the dosing recommendations on the back of the bottle pills are actually adequate for most people. However, you should really pay attention to the people that can't take it. So if you have a heart problem, if you're diabetic, you really want to talk to your primary care doctor first before you start embarking on taking over-the-counters. Also, if you have abdominal issues or GI issues.
And ibuprofen is Advil or Motrin. They're the same stuff, right?
Exactly. Same category, correct. So Motrin, Aleve, Advil are all within that category of anti-inflammatories.
Let's talk to Eleanor in Montgomery County. Eleanor, thank you for calling. Go ahead.
Hi. I have, my index finger is misshapen, and it kind of looks like what my aunt had. She had very bad arthritis, but I don't have any pain. In the morning, I have some general stiffness in both hands, but there's just one digit that is affected, seemingly. Should I be concerned? Is this arthritis? What is it?
So it's very common for arthritis of the hand to present itself in the very distal joint of the finger. So think about the distal and the secondary joint. The distal joint is the most common one, and it's very common to see quote-unquote bumps on the top of the finger. And yes, that typically is regular degenerative arthritis. Typically, we recommend that you don't do anything if it's painless. And just like the patient said, pain is the key. If it's painless, leave it alone.
General advice for somebody with one of these issues in terms of where to seek out advice. Calling the doctor on television is one choice. But do you start with the primary care doctor? At what point do you need to see an orthopedist?
So yes, you should definitely start off with your primary care doctor, especially to make sure that you're a candidate for some of the over-the-counter anti-inflammatory medications. And if the simple routine rest, exercising, splinting, and if your primary care doctor is comfortable doing injections don't help the symptoms, then at that point they can refer to an orthopedist.
Alexandria, Virginia. Let's talk to Debbie. Debbie, thanks for calling. Go ahead.
Yes, hi. I have arthritis in my hands, and I also have had a lot of overuse, and I have worn splints, and it was recently recommended to me to take glucosamine credotin, and so I started taking that supplement. I wanted to know if you thought that was appropriate.
Great question. Thanks so much.
That's an excellent question. So there are a number of large studies that have been done looking at glucosamine chondroitin and seeing if there's really a significant difference in outcomes, and including pain and progression of arthritis. Unfortunately, those studies don't particularly involve the hands. We've done more for the bigger joints in the lower extremities, but it really hasn't been found to make a difference. So that's the answer to that overall question. But for the hands, there's no specific data regarding use of glucosamine chondroitin and hand arthritis prevention.
Baltimore City, this is Sean. Sean, thank you for calling. Go ahead.
For some reason, my fingers feel swollen, and my middle fingers are locking on me. I can't make a complete fist. And I'm wondering what's causing that, and is there something I should really be concerned about?
Thanks very much.
It's very common with stiffness in the finger and with locking of the finger to have something called trigger finger. And trigger finger is an inflammation of the tendon sheaths that travel into your fingers as they travel up and down, and they're little pulleys that hold them adjacent to the bone so they don't bowstring in and out of your hand. And when it gets inflamed, it gets caught in there, and patients have this trigger where they can bend it and they can extend it.
And is there a therapy for that?
And there are treatments, including splinting and injections. And if it doesn't resolve, the eventual treatment is surgical treatment to release the trigger.
Dr. Ngozi Akabudike joins us from the University of Maryland School of Medicine, University of Maryland Medical Center. For those just joining us, we were focusing on carpal tunnel syndrome and problems of the upper extremities. And to recap on that for a second, there is a surgical solution to it, which you perform, but there's other steps to prevent and treat the problem.
Absolutely. There are a number of mainstay treatments that we have in place. The first is splinting. So what does that mean? So keeping the wrist in a position that avoids any hyperextension or hyperflexion to prevent any tension on the nerve. So it's wrist splints and wearing them either at nighttime or during the day with any activities that aggravate those symptoms.
So people who type a lot, I've seen little, they're not the hard cast kind of things, but it certainly restricts your movement when you're at the keyboard.
Correct. The other option are injections, corticosteroid injections, and the goal is to bring down the inflammation at the level of the carpal tunnel and hopefully improve the patient's symptoms.
Is it the sort of thing where somebody comes in and you can provide one injection, maybe a splint or an ergonomic change to how they're working, and you never see them again, or does it tend to escalate?
It's a good question. Yes, there are a number of people who actually do well with just initial conservative treatment and the symptoms go away.
That's happy news. Let's take some phone calls. Alvin in Baltimore City. Alvin, thank you for calling. Go ahead.
Yes, hi. How are you?
Good, thanks.
Doctor, how you doing?
Good, thanks for asking.
I have a question. I've been diagnosed with degenerative disc disease, right? And I've been prescribed pain medicine, and also it was suggested that I take injections. And I think that those procedures mask the pain, but it does not fix the actual degenerative process of the disc. Do you recommend surgery for that type of situation, or is this something that you don't deal with at all? You just deal with upper extremities.
Alvin, thank you so much for the phone call. Best of luck to you. And doctor, you teach and deal with everything.
Yes, the caller brings a really interesting point and good point about masking symptoms. And so the caller's talking about degenerative disc, which is a spine problem. But sometimes a degenerative disc or disc disease can cause arthritis in the spine that irritates the nerve that goes into the upper extremity. But injections and anti-inflammatories help with your symptoms, but if they're not getting better, absolutely, the next step could easily be to consider surgery if you're not getting better, because they can mask those symptoms and not improve your true outcomes.
Let's go out to Baltimore County, talk to Beth. Beth, thank you for calling. Go ahead.
Yes, does cracking your knuckles have any effect on your hands?
Fabulous question. I'm so glad you asked.
That is a great question. And no, we don't have any evidence that shows that that's detrimental to your joints in particular.
Now, the explanation you hear is that there's some instant, when people do that, and I can't and I'm not going to, and it bothers me, but when somebody does it, it creates a momentary bubble in the joint. And the crack is the bubble either expanding or contracting really fast.
Correct. As the fluid in your joints, and you're just sort of moving it around in the joint. But no, it's not particularly detrimental.
It can't be good for you.
So it's a different conversation. But you probably shouldn't do it if you don't have to.
Very good. Good. That's what I was hoping to hear. A quick call. Let's talk to Mary in Baltimore County. Mary, we just have a few seconds. Go ahead.
Hi, I was calling because I have been diagnosed with mild carpal tunnel, and I'm wearing the splints at night, but at work I use my hands a lot, and my hands get so numb that they hurt, and I have to actually stop what I'm doing because my fingers are going every which way, and the only relief I get is to run hot water over them.
Mary, we'll get you an answer on the air. Good luck to you. Next step?
When it gets to this point, you probably should see a specialist that deals with carpal tunnel syndrome.
Okay, and Dr. Ngozi Akabudike is such a specialist, joining us from the University of Maryland Medical Center. Doctor, thanks for your time tonight.
Thank you for having me.
We really appreciate it.
Your health segments are a co-production of Maryland Public Television and the University of Maryland Medical System.